Good afternoon and welcome to the fourth session of the 2020 Virtual Clean Med Series. We're very pleased to bring you this virtual experience. My name is John Ullman and I'm the Director of Safer Chemicals and Procurement at Healthcare Without Harm. It's my pleasure to be moderating this session today. Before we get started, I just want to share a few notes and announcements. Okay, we'll have two more Clean Med virtual sessions, and we hope you can join us for those as well. We'd like to thank Kaiser Permanente for supporting our virtual series this year. While we look forward to future years when we can connect in person, we recognize the challenges we are all facing these days. That's why we're excited to let you know that Clean Med 2021 will be an even larger all-digital experience. We'll share more details in the coming months. Look forward to your participation in a safe, exciting virtual Clean Med 2021 experience. Next, please note that this session is being recorded and made available afterwards. Also, if you have any questions for our panelists at any point during our presentation, please submit your questions in the Q&A box. And if a question is meant to be directed to a specific speaker, please also include their name as well. We'll then have time at the end of our session for questions. Lastly, if there are any comments or technical issues, please use the chat function and we'll do our best to address those. Okay, before we turn to our speakers, I'd like to provide some context for today's session. Okay, one moment as the slide's loading. Sorry about that, a little slow. Okay. So I suspect many of you in attendance today know all too well, we were forced to face a harsh reality earlier this year that there are greater vulnerabilities in our supply chains than many of us realized. This was most obvious in the early days of the pandemic when there were shortages of personal protective equipment, hand sanitizers, and other products for which many issues still persist today. We also know this is not a one-time disruption, as we expect there'll be more crises in the future, particularly driven by the effects of climate change, and we have now seen the value and importance of supply chain resilience. Also during the pandemic, we've learned that many healthcare facilities were forced to rapidly adapt their operations, being focused on treating COVID patients while not enabling the further spread of the disease in their facilities. In some cases, long-running sustainability and wellness programs, like many other activities, were put on the back burner. However, we've seen that not all facilities made the same decisions, as some had systems in place with the right stakeholders already connected to identify better solutions in those moments. In fact, as we will get into today with our speakers, many existing sustainability and resiliency measures incorporated prior to the pandemic were an asset and not a liability and proved really valuable. As a simple example, facilities that had previously converted from disposable to reusable gowns in order to reduce waste weren't faced with the same challenges when disposable gowns were in short supply. So we all know we need to continuously be messaging the value of sustainability. I also just mentioned another related topic, which is that there's been a lot of confusion in the marketplace over the last year around disinfectants, cleaning products, and buying products such as furniture with antimicrobials, or even adding antimicrobials treatments to existing surfaces due to uncertainty surrounding COVID. Addressing antimicrobials has been a priority for Healthcare Without Harm Practice Green Health for quite some time, as we work with healthcare members, manufacturers to remove antimicrobials from furniture, flooring, and other products. When COVID arose, facilities that had already been working with us on the safer chemicals issue understood the broader context and complexities with antimicrobials and knew the right questions to ask and improve decision-making, and ultimately, in this case, not add potentially unnecessary chemicals into their facilities. So if this is a topic of interest to you, we did post an update to our 2016 paper, so in August, which is represented on the slide. You can find our website in the slides later. We can tell you more about those, provide more examples about that. And then lastly, I just want to say that we've unfortunately seen how vulnerable populations have been disproportionately affected by the novel coronavirus directly and in so many other ways in our society. So with this in mind, we should look at the opportunities that can arise when thinking about resilient supply chains. Healthcare is in a prime position to provide leadership and drive changes to supply chains that have far-reaching effects. Healthcare systems and facilities are often anchor institutions within their communities, meaning they are rooted in their local community and have close connections to many of the residents. As major economic engines, they have significant purchasing investment power, and they can bolster the communities they serve, building stronger local economies and climate resilient infrastructure. And additionally, they can also leverage their own purchasing to address social determinants of health, which are the many different social, economic, and environmental factors which shape our health. Social determinants of health, such as job opportunities, access to quality education, and access to nutritious foods, can contribute to inequities. As we saw with COVID, an important social determinant of health in the world was prior exposures to air pollution, which could lead to greater susceptibility and worse outcomes when infected. So because of the pandemic, healthcare systems are now rethinking their supply chains, and because of their roles as anchor institutions, they have the ability to address the many issues we just covered, and through those actions, create more resilient supply chains that they can benefit from. So with that, I'd like to turn it over to our amazing experts for our session today on rethinking supply chain in response to COVID-19. I think slide just went ahead. One moment. Okay, first we have Curtis Lancaster, the Vice President of Supply Chain. Curtis has over 30 years of business and supply chain operations experience and is responsible for the overall strategic direction and tactical execution of all aspects of supply chain management at Dartmouth-Hitchcock Health, including all supply expense management, procurement, distribution, customer service, and supporting technology. At Dartmouth-Hitchcock, he focuses on demand planning, supplier resiliency, data enrichment, diversity and inclusion, non-traditional trading partner relationships, and sustainability. Curtis also directs the overall supply chain strategy for New England Alliance for Health, a regional hospital collaborative. Also joining us is Shane Hughes, Strategic Supplier Management, and throughout Shane's 17-year career at Intermountain Healthcare, his areas of focus have been surgical services, purchasing, contract management, and supplier relationship management. His current role involves creating an environment of collaboration and supplier relationships, sustainable procurement, and qualitative supplier performance and engagement. So with that, I turn it over to our first presenter, Curtis.
Thank you, John. So my name's Curtis Lancaster. I'm Vice President of Supply Chain at Dartmouth-Hitchcock Health. And today, going to talk a little bit about what Dartmouth-Hitchcock Health did in preparation prior to the pandemic, a little bit of what we did during, and what we're thinking our supply chain and other supply chains may be going in the future. So first, just a little bit about Dartmouth-Hitchcock. As you can see, we're a remote academic medical center or medical system. Medium size, small to medium, 2.3 billion is our revenue. We are an academic medical center, as I mentioned. The little map over on the bottom left shows many of the sites where we have some sort of interaction. So we are members of a GPO, as most of you are, but we also lead a local alliance of hospitals, community access and critical access hospitals called NIA. So our touch goes in both New Hampshire, which is a state on the right for those that don't know, and Vermont. So it's a two-state region. We're the #1 provider in New Hampshire and the #2 in the state of Vermont. Like many people, we came to realize that supply chains are in constant change and flux. There are vulnerabilities everywhere. And we were aware of this when Hurricane Maria hit Puerto Rico. And we started acting at that point, saying, what can we do to have not only better visibility, but resiliency for when something does happen? And so you can see from the map, there's all sorts of disruptions that could happen. There's nuclear, there's FDA, SARS, many of us experienced many years ago, H1N1, et cetera. And then of course, the most recent pandemic. We subscribe to a service that provides us alerts. These alerts, some of them you can see listed in the middle there. We didn't know if these alerts meant anything to our supply chain. So for example, fire at a rubber company in Brazil. they have a healthcare manufacturing in Brazil, but we didn't know if that had anything to do with our supply chain or any disruptions, port disruptions. Just recently, there was a Chinese county that reported the bubonic plague, and we're thinking, oh no, here we go again. So the point is, there's disruptions that I didn't even know were happening throughout the world on a daily basis. Then we became aware of them and realized, now what are we going to do? One of the pictures I want to point out here is the one with the Chinese military next to the hurricane. That's an actual picture. One of our sourcing agents or partners was at a factory in China to do some sourcing to get us some N95 masks with a Chinese manufacturer. And as he was there getting ready to bid on a lot of the N95s, the Chinese military came in, took control of the plant, and as you can imagine, we didn't get any N95s that day, nor since. But the point is, you know, on these disruptions, they're going to continue. So what do we do as supply chains to be able to be prepared? For the pandemic, we started getting alerts from the system that I was mentioning back on January 3rd, that there was a virus alert in China. Didn't really pay too much attention to it, but then the next day, there was a flu-like outbreak in Wuhan, and that got my attention. I had previously, about 5-6 years ago, had a health system I was working at in the West Coast. I'd flown to Wuhan, China. We were looking to manufacture product for our health system ourselves, and so I was aware that that could be a problem with a lot of the products that we purchase. A few days later, or a week or so later, there was a recall of surgical gowns. And my partner and counterpart up at the University of Vermont Medical Center, Charlie Michelli, and we were talking and said, oh no, in a couple of days is the Chinese New Year. And we knew that a case had hit the state of Washington, and we wondered if there was going to be a lot of people traveling to China for the New Year and then returning back to their countries of origin, and in the United States for us, and if this could get ugly pretty quickly. So on that day, we ordered some surgical gowns. The point is, having an early alert system is helpful. It gave us a couple week head start on being able to make sure that we had some product that we were going to be able to have for our health system for continuity of supply. So we ordered those, and then, as you can see, just a lot of different events happened from that point forward, as we all experienced in the March, April, and beyond timeframe. So this is a heat map of what we're trying to do. We were doing this pre-COVID, yes. During COVID, absolutely yes. So we're trying to monitor our suppliers. Not just any of those events like the ones that you saw earlier that was possibly a port disruption in Australia or a rubber factory in Brazil, but where's my product manufactured? And so we're working with this vendor to map exactly where in the world our manufacturers are manufacturing the product. And then they alert us with those alerts based on any sorts of vulnerabilities that may exist from macroeconomic, geopolitical, pandemics, it could be. I think personally, this is going to be the way that all of our supply chains are going to need to operate in the future. And I'll get to this a little bit later, but we need to be able to focus and have visibility into where our product is being manufactured. This is just another slide. It gives a little bit of information, how many suppliers, how many sites, how many parts are mapped. And then you can see, I know it's a little small, but the different categories, category of plastics or packaging. It just gives great visibility into the supply chain that we really didn't have before, and we're just barely starting to pay attention to when the pandemic really ramped up. So during the pandemic, the critical trust factors that we had, I would say trust. We'd been working in our supply chain for a number of years to be able to build a foundation of people. That was our number one strategy, technology, trade relationships, and then innovation. And this all came together and crystallized during the pandemic. The people rose to the occasion. My people were absolutely fantastic. They took their roles, and with all the work that we had previously done, just did an exemplary job making sure that we had PPE for our health system. And so the trust that we had in them, but also the trust that we had with the UVM system. So we had been building a relationship with that health system that's to the northwest of us for a while, and we ended up dividing and conquer. So one group said, okay, we'll take face shields and we'll find a local manufacturer for face shields. The other group said, okay, we'll take hand sanitizer. And so working together, we were able to divide and conquer much better than if we just tried to do it ourselves. When we did order, as I mentioned, the surgical gowns, we sent 4 containers worth of surgical gowns over water. We started sourcing our product through Canada, having the logistics flow through Canada. What we were experiencing was there were backlogs at the airports, of course, in China, but then at the airports in the US. So we redirected to Canada. And there was at one point a threat that the Canadian borders were going to shut down. So we quickly engaged our government relations team, who were invaluable in helping us with customs and at least getting our message to the right people that we needed those borders to stay open. And then, of course, absolutely critical is the analytics. You know, when this first hit, we didn't know how much of everything we needed, and we didn't know how many patients were going to present. And so we created a very quick and simple model that was, you know, how many N95s per COVID patient, how many gown changes, how many gloves. And we came up with a small formula of how much PPE we needed per patient. And then we made an estimate on a week by week basis on how many we were anticipating getting based on some of the models that were out there. I think there was a Johns Hopkins and the University of Washington and others. And so we started sourcing to that specific number. And prior to that, you know, we didn't really know exactly how much and to what complement we needed. Ultimately, it was the strategic plan that we had been putting together prior to the pandemic that not only guided us, but really showed that we had been focusing on the right things. So as I mentioned, these are the 4 pillars of our DHH strategic plan, all around our patients. We support the hands that heal. And so our clinicians and our patients are who we really do our business for. And so we keep that foremost. So when the pandemic hits, we know we have to keep not only our staff safe, but the patients and communities that we serve. So now we're sitting back and we're asking ourselves, what happened? How did we get here? How did we get to the place where a pandemic could hit and we didn't have control or visibility into any of our product? We were dependent on others, whether it was a distributor that's trying to service hospitals across the country and taking special care of the different hotspots that are there. How do we get control back, or at least visibility back? What's that start to look like? So now that we've had the opportunity to take a breath, we're starting to zero in and focus in on what is this going to look like going forward for Dartmouth-Hitchcock Health and likely many of the health systems across the country. So one of the things I think most of us have focused on is bringing product local. And this is great, being able to help local manufacturers, local businesses. As John mentioned earlier, we are all anchors of our communities, and being able to shift some of the spend that we have from a multinational organization to a local, where you have to strategically do it, is very valuable, not only for the continuity of supply that it affords the health system, but also for the businesses and communities in which we're buying those products from. At the end of the day, whether we do it local or not, we need to be closer to the manufacturers. And whether that means we reshore things back to the US or North America, or continue drawing close to them electronically while it's offshore, we just have to find a way that we can serve our supply chains better. For us, we'll disintermediate a little bit where we can. We want to make sure that we have that visibility. If that means cutting out the middle person, then that's what we'll do. If it means partnering more closely with our distributors and manufacturers, that's what we'll do. But one thing that came very, very clear to me was the need to focus on raw materials. So, prior to this, I knew of some raw materials, but I didn't really know them as deeply as I do now. Most of us have heard of the term SMS. It's the product that goes into the disposable face shields that's disappearing on the shoe. And it stands for spun bond, melt blown spun bond. And it went into short supply as manufacturers across the world shifted their production to try to make as much N95 and gowns and masks that they could. The problem is SMS is used in 43,000 SKUs. So as all of that production shifts to masks and gowns, what happens to the other products like hot and cold packs, like diapers? Are those going to run in short supply? So that's what I started worrying about, if there was going to be some sort of struggle getting those other products. So while I was focused on masks and gowns, I started shifting my focus to others. We know of other products that are out there, isopropyl alcohol, which is a component of the hand sanitizer that we use. There's quaternary ammonia, which is used in the disinfectant wipes. We also found out that CO2, the gases that we all use, are a byproduct of the production of ethanol, which is used in gasoline. And as people were starting to work from home, there was less ethanol produced and therefore some less CO2. So we start seeing all of the interdependencies of these different raw materials and how they can impact us down the road, not just in a shortage of one product, but shortage of multiple products. And so our focus that we're going to be looking at coming out of this pandemic is a strong sourcing arm on raw materials. We want to build a dashboard, identify maybe the top 50 to 100 raw materials we use, and create a dashboard, much like the event alerts that we saw earlier from Brazil, or the bubonic plague, or the rubber disruption in Brazil. We also want to know when quaternary ammonia or whatever else is starting to struggle. This is a slide on our people pillar. Just real quick, I'll go over this. I won't go into too much detail. Our goal is to attract, develop, and retain. The key part of that is we've been working on this for a while so that when the pandemic hit, we had the people in place that were going to be able to help our health system. We have certain goals and pathways to success to be able to achieve that particular strategy. I won't spend too much time here. And then the other big one was innovation. Think different, plan different, and do different. The third bullet point under think different, I think we all need to embrace, and that's embrace the improbable. A year ago, I don't think any of us would have thought that things like toilet paper, disinfectant wipes, and Purell hand sanitizer would be in short supply. And the pandemic is the first global disruption we have, but there could be others, and they might not be a negative. It could be a technology, a wave of technology like synthetic biology or advanced robotics that causes disruptions in our supply chain. The point is we have to be at all times alert, sort of like a radar that passes along, trying to get an early alert of something. We have to know about the disruptions that are out there, the raw materials that go into our product. I'll skip over this for sake of time and go to the next slide. So what I want to bring up is sort of towards closing for my part is how do we integrate, since we're going to be looking and rethinking our supply chain and how we focus on sourcing product, how we focus on acquiring product, how can we integrate sustainability into that? All of us forgot about sustainability, or at least it wasn't forefront of our mind when we were outsourcing masks. I see many of these masks now just thrown out. They're on the ground. They're going to end up in landfills. To John's point, we were one of the organizations that had already started using reusable gowns. That helped us a lot. So it's starting us to think, how can we reduce our carbon footprint? How can we look at these chemicals of concern and these raw materials of concern? And it's getting closer to the manufacturers. It's getting closer to the production and actually weighing in on what we want to be in there in the products that we use. And I would say one of the key things and challenges I give to both myself and our and my other supply chain peers is we need to change the message to our healthcare executives. All of us have had the goal of either cost reduction or margin enhancement, and that's been the key thing that supply chains have done in providing value to their organizations. Then we started layering in and realized the importance of sustainability. Now we need to continue that even more so. We need to grab more control over what we do, not let that control shift to somebody else like a distributor or manufacturer, but influence and demand that the materials we use are safe, not only for us, but for our patients and for our earth. It's going to help us in layering in not only sustainability, but the social determinants of health as part of the goals and the value that we deliver to our health systems. And with that, I'll turn it over to Shane.
Thank you, John. Good afternoon, and thanks for your time today. My name is Shane Hughes, and I'm responsible for supplier management across Intermountain Healthcare. We are based in Salt Lake City, Utah, and currently have a footprint from around Boise, Idaho, to Las Vegas, Nevada. And our executive leadership team is really focused on growing our footprint and understanding what other areas within our community could require healthy, high quality healthcare in their communities. Thank you, Curtis, very much, for your comments and your content today. Even though we are in separate regions of the country and we may be different sizes of health systems, I think we've all experienced very similar concerns and issues during COVID-19 and the pandemic. As you can see on the screen here, Intermountain Healthcare began in 1975. Today we currently have 24 hospitals and approaching 3,000 licensed beds. We also have an integrated health plan for all of our members, and a medical group that consists of over 200 clinics today. We also are focusing on telehealth, which has, in light of COVID-19 and the pandemic, has expanded astronomically over the last few months. We also own our own GPO, which is pretty unique to the industry. Intelair we purchased in 2015, full ownership, and are working in strategic ways and collaborative ways to work with a broader supplier community to really reduce the cost of healthcare to our communities. And just to kind of paint a bigger picture of the size and contribution of Intermountain to our local economy and the potential, and that's something that I really want to touch on today is our potential as anchor institution, as both John and Curtis has mentioned. Traditionally, anchor institutions have been large educational systems, state or local governments. However, I think most of us, because of the work of the Healthcare Anchor Network, because of the Democracy Collaborative, because of Clean Med and Practice Green Health, we're starting to realize that health systems can be anchor institutions in the communities that we serve. As you can see that we are, approaching 7% of Utah's economy, as well as just under 8% of Utah's jobs. Also, our tax revenue to the state of Utah is just under 5% of the total tax revenue. We hope to use our size and our growth strategy to really make important changes in the communities that we serve, because over the last few years, I think we've really understood that we can't affect an individual's total within the four walls of our hospitals or clinics. based on this graphic, only 20%, we can really only affect 20% of an individual's overall health within our hospitals. And our mission is to help people live the healthiest lives possible. We really need to focus on healthy behaviors and other socioeconomic factors that can be traced back to the zip code that you reside in. And that's unfortunate. And those are some of the things that we want to focus on and change moving forward. One program that we've been working on over the last few years and some strategic goals that we've established is focusing on some of the health behaviors of our patients in our communities. Something that we've run a pilot in one of our facilities in our southern region where we've established a food pharmacy so that patients that may have chronic illnesses that go to their doctor at our facility can be prescribed local farm fresh produce and can go to the location within our hospital and learn how to prepare those vegetables at home, take those vegetables home and prepare them at home from a chef and from some of our dietitians. Those are some of the things that we need to focus on more going forward. And we really need to rethink our role in the communities that we serve. As an anchor institution, we need to focus on supplier diversity, on impact investing, on sustainability and community wealth building. And I'll dive into some of the details around our efforts on each one of those. But I think we all understand that, to obtain a financially stable community, we need to have thriving, diverse businesses, access to affordable healthcare and housing, and education and community safety. And as health systems, we play a role in that. So why does this matter? We can talk about how we can improve the communities that we serve, but what have we been doing from a supply chain perspective at Intermountain Healthcare to really make a difference? And, over the last few years, we've really focused on developing an internal policy and contract language. We developed what we call our sustainable procurement policy, where we focused on identifying more transparency in our supply chains, but also identifying what kinds of chemicals of concern are within the products that we purchase or that are consumed during manufacturing of those products or services. We also developed a contract clause that we include in all of our contracts going forward that states that we will not be purchasing products with chemicals of concern in them going forward, that we would like to see that visibility within the supply chain on all products and services. To be totally transparent, some of our suppliers have pushed back regarding some of those requests from Intermountain Healthcare, but we've started that conversation with them, and that we've made it very clear that healthcare will not stand by anymore and just purchase products like we've done in the past, and that we really need to change the way that we procure products and services. In addition to that, we've developed a supplier development program. On a quarterly basis, we are focused on what we call our local, diverse, and sustainable supplier day, where we invite suppliers from the community and provide information and educational sessions to them. With that, they are able to provide information on their products and services to us through a form, and then we reach out to them if it's a good fit for the supplier and if it's a good fit for Intermountain as a whole. we've really identified a long list of potential products that are high quality products that are very competitive from a price standpoint as well through this process. Also, with our efforts with the Healthcare Anchor Network, we've developed a Supplier Diversity program where we are establishing a goal for the next 5 years on the amount of spend we're increasing in local, diverse, and sustainable suppliers. Along that same line, we are also developing a goal to remove PVC and DEHP from at least 2 to 3 different categories within our product. That's an ongoing project that requires a lot of collaboration with our Director of Sustainability and with our supply chain peers as well. Over the last 6 months, I was tasked to perform what we are calling a lessons learned audit. We interviewed over 30 individuals from finance to supply chain to our clinical areas to understand how COVID-19 really impacted our clinical caregivers, our supply chain, and our finances. And I'll just touch on a few successes and opportunities that we have. So you may not know, but Intermountain Healthcare, in 2012, we established a self-distribution model within our supply chain where we purchase directly from manufacturers and then distribute to our hospitals from a centralized fulfillment center. Without having that in place, I think we would have been in a more difficult situation. As of now, none of our healthcare clinical workers have had to go through any clinical practice without the appropriate PPE. Some of the opportunities that we really are seeing, and I know Curtis has touched on as well, is how do we repatriate commodities and other PPE supplies? How do we really work with local manufacturers and regional manufacturers? How do we streamline the decision-making process when it comes to purchasing large quantities of PPE or other products? How do we rationalize our supplier base as well? And then how do we integrate even more our emergency management system and our pandemic inventory? You know, Winston Churchill once said, "Never let a good crisis go to waste." I would probably suggest that, you know, this is not a good crisis. However, we took advantage of the crisis. Right in the meat of, you know, COVID-19 in March, we approached our executive leadership team and said, hey, you know, we see a gap in our supply chain process. We need to hire an additional resource where they are focused on solely supplier risk and business continuity. We hired an individual in the summer, and they're currently working on identifying the process for supply chain mapping internally with key suppliers and our critical items list. Along that same process, she is also identifying with our suppliers any chemicals of concern contained in those products. You know, but in all transparency, we have received a lot of pushback from some of our strategic suppliers that we've really developed relationships over the years. So I think as health systems and as a health industry, we really need to work together to be able to, you know, force the market to be more transparent, force the manufacturers to be more transparent in the chemicals that they're using to produce products and where the raw materials are coming from. And, you know, from personal experience, I know that one single health system cannot do that. So we're looking to all of you to collaborate and start moving the market in the right direction. So just in closing, we really need to establish, and our goal is to lead by being a model. And our goal is community stability. And we're really focused on developing our local and diverse purchasing program, really focused on impact investing, developing that program out, and really understanding what are the needs of some of our suppliers. Early on, a year and a half, 2 years ago, when we started this program, we thought we knew what our suppliers needed. That's changed based on a lot of conversations we've had with our suppliers. And to be able to understand the needs of the suppliers, we need to get closer to them. We need to create transparency in our supply chains and understand their needs and see if it would be a good fit with a specific local or neighborhood supplier. We really need to shorten our supply chain and remove any of the chemicals of concern from our item master and creating that visibility. Because everything we do really does make a difference. I just wanted to, in closing, share an example we had recently with a few local suppliers, very small suppliers in niche markets, that one of them reached back out to us after a pretty small order from Intermountain standpoint. But she said, just because of your order and your focus on local and diverse suppliers, we are able to keep our doors open even longer now through the pandemic. And we're able to employ more people and continue to employ individuals because of our single order. So what we're talking about today really makes a difference in the overall health and well-being of our communities. So thank you very much.
Okay, thank you, Shane. So we'll switch to question and answer in just a few moments, a few minutes actually. But while you're thinking of your questions and put them in the question and answer box, we first want to share a new tool that's really useful when it comes to procurement and thinking about process and prioritization. And for that, I'm going to introduce Beth Eckel, who's the Director of Environmental Purchasing, and my close colleague, has over 20 years experience in sustainable procurement. Of that 10 years with Practice Green Health. And she was one of a team of colleagues who oversaw development of this new resource we're introducing, and she'll share with you now. Thank you, Beth.
Thank you, John. Hi, everybody. I'm pleased to share with you a new tool we just released for healthcare leaders. It's the Sustainable Procurement and Healthcare Guide, and it's specifically written for sustainability and supply chain professionals to learn how to embed sustainability into the procurement process. It features stories from over 25 healthcare organizations around the globe, and it also highlights 10 key best practices that every sustainable procurement program will want to have in order to be successful. With hundreds of contracts utilized by group purchasing organizations as well as healthcare organizations, we're asked many times about where should I start? Where should I begin to focus on my efforts on sustainable procurement? And the guide actually offers a roadmap to help prioritize where to start to align with organizational goals and objectives. Products used in healthcare can have human health and environmental impacts, and through their life cycle, through development, production, distribution, and end of use. Sustainable procurement is really viewed as preventive medicine in order to reduce the impacts from those products. And healthcare workers, as one example, have one of the highest rates of asthma of any profession. And by minimizing the chemicals used in things such as janitorial cleaners and other products and specifying them with low emissions, we can affect the health of workers as well as patients and those in the community. According to a recent report from Healthcare Without Harm, the lion's share of greenhouse gas emissions are from supply chain, from the goods and services that we purchase. That's through production, distribution, and disposal of those goods and services. In order to reduce greenhouse gas emissions, many of our members are looking at using, say, moving to reusables as one opportunity. With the shortage of PPEs during this pandemic, one healthcare supply chain executive shared with us last week that he's now viewed as a hero because he has moved from reusable surgical gowns, from disposable to reusable several years ago, and now they view him as a hero. And that was one way that system has been able to address the shortage of PPEs. So to target products, the guide does offer a list of high impact procurement opportunities that supply chain can target in order to reduce the impacts to reduce waste, to reduce greenhouse gas emissions, and more. As finances are constrained, particularly during this pandemic, sustainable procurement can offer cost savings, and the guide offers the business case for sustainable procurement, and it also offers examples of where hospitals can find cost savings. And this infographic illustrates many of them, and most of them are related to moving to reusables, like moving to reusable medical products, or using rigid sterilization containers instead of disposable blue wrap. And hospitals, Practice Green Health member hospitals, have saved $56,000 annually per operating room by implementing these objectives. Healthcare organizations are anchor institutions, as many of our speakers have alluded to, and as such can have an impact on improving the community by what they buy. And the Sustainable Procurement Guide helps you to embed sustainability into the process and use the power of procurement in order to improve human health and the environment for patients, for workers, and for communities. And reducing exposure to chemicals of concern can be achieved through sustainable procurement. And this will also help you being prepared for potential disruptions in the future. As part of this guide, we're also developing training resources, and so we look forward to sharing those with you in the future. Thank you.
Okay, thank you, Beth. So we'll shift to questions now. And I think the first one that we have, we'll direct Curtis your way. Could you share a little bit more about when you talk about raw materials, since that seems like a whole new territory that you're getting into. How are you kind of going about that process, and how is that different from kind of your evaluations of materials in the past, and kind of what are some of your next steps that you're thinking about for the raw material mapping and assessment and strategy?
Yeah, so a couple of things there. Number one, we have a technology partner that helps us in this space. And we're enlisting the helps of other health systems. Intermountain happens to be one of them. And our goal is to identify, the critical raw materials that go into the products that we have to have, whether it's a, PPE, something in the OR, et cetera. But as we're doing that, it's going to inform us of the raw materials that we're actually using. We have no idea where they come from. So when we talk about a manufacturer, we know they manufacture product in, I don't know, Mississippi, let's say. But where do they get the raw material? We don't look upstream for the whole ecosystem of those supplies. And it's important for us to know where they're made, how they're made, what the impact on the planet is. And so we don't have all the solutions. We're just launching this. So if anybody's interested or has ideas on how we can identify specific items and then mandate what's in them for the manufacturers we have and how we can track them. I mean, we have the way to track them. We just need to be able to know what they are and which ones we should track.
Great. And for anyone else who wants to post questions, we'll probably have time to get through 3 or 4 additional ones today. The next one, I think I could go to either of you if you want to speak to it. So it's really about just the business case. So, and the person writes, on one hand, they want to reduce costs. At the same time, they want to support their communities with income, and more income is better for the community. So how do you balance the cost with community benefit, or are they not mutually exclusive?
Thanks, John. I can touch on that. You know, we've had those conversations over the last few years of balancing, you know, community support and community stability and pricing, right? And in our experience in certain categories of our suppliers, for example, in food and nutrition and other categories, we haven't seen that as the case. You know, we've developed some pretty collaborative relationships with local food producers, for example, where they were able to drop their prices to a certain price point that it made sense for us to move from our current supplier to a new local diverse supplier. So not always is there a price difference there. However, you know, when we develop some of these relationships, for example, we over the last 1.5 to 2 years developed a relationship with a group called the Food Hub, where we were able to aggregate food and produce from the surrounding areas. Because of that aggregation, the cost of the food was lower than our current cost. So developing some of those strategic relationships can lower the cost, and we can benefit the community as well. But at the same time, we've had those conversations with our chief financial officer, and where, you know, at what point does it make sense to move from high quality products to a local high quality product at a little bit higher cost? And we're continuing to go through those conversations, and there's no easy answer, but there is a solution if you work together with community partners.
And John, if I could just add on to that just real quick, because we've been asked for years to reduce cost and pull cost out of supply chains. And that's what's got us largely to where we are, product being moved overseas to less expensive locations. And who says that a lower price point is high value? So we just have to change the communication we have with our executives, similar to what Shane and his team are doing, to say continuity of supply is just as important as a price point. Building up a community and investing in the local communities so that they're healthier communities is just as important and valuable as a lower price point. So it's just changing the definition of what we deliver as value.
Yeah, thank you so much. It's going to be one of the biggest, most common questions that come up, and it's really just reframing what is value, how do we value things, and so those can be addressed. Next question, I can pose it to either of you. It speaks to, I think, the person's asking about manufacturers and suppliers, but could, I think, be more broadly applied to distributors and others you deal with. How do you push them more sustainable practices? I think the question is getting at kind of how do you exert your purchasing power, and how do you drive those changes? You know, what's it actually look like from your perspective to make those changes happen?
Well, I'll jump in, and Shane just fill in the gaps. We can't do it individually. I'm a small to mid-size health system in rural New Hampshire, or rural New England, and you know, we need to band together and make decisions with our pocketbook, but we have to be serious about it. You know, we can talk sustainability, we can talk being green, but if we talk about it but then continue to spend on non-green products or non-sustainable solutions, there's going to be that market. We have to shift how we do business, and we have to do that, not just one health system or two, but all of us. Yeah,
John, I just to add what Curtis, you had just mentioned, you know, that conversation is hard, and just this week we've been having those conversations with some of our largest suppliers of, please provide the information on specific products, what raw materials go into them, what chemicals are included in them. It's a difficult conversation. Something that we've done in the last 6 months to a year is we've developed what we call our supplier performance dashboard. So for some of these suppliers that are not providing that transparency that we need in their supply chain, we actually have a metric on our dashboard and developing that says, hey, they're not sharing the required information for chemicals of concern, or the location that raw materials are sourced from, or locations of manufacturers. So creating that transparency in a dashboard where we can say, hey, your overall performance suffers if you're not sharing this information. Doing that and creating that process has moved some of our suppliers. However, Curtis, as you mentioned, it will take a cohort of health systems to be able to move the entire industry.
Absolutely. And then the last question we'll get to, only have about 30 seconds if you just want to speak to, one of you want to speak to it quickly. Have you had any success utilizing any contract outsourcing services like environmental services or food service management to ensure your contractors are holding to your priorities as well?
So John, the question is if we're using outsourced and if we're holding them to environmental standards?
Yeah, holding them accountable and with the same objectives as you might for other types of procurement and contracts that you have.
Yeah, I'll give you one simple one. And this isn't exactly on environmental service or food service because we don't have those outsourced. But on we have a courier partner that you saw our map. We're all over 2 states, and we've required green vehicles on 60% of their vehicles to be green. It's a small start, but that's the type of thing that we're starting to do, is embed little clauses into the contract that require that, and then just make sure that they're staying on the business reviews that they're complying.
Okay, thanks for the quick answer. And there are many questions that came in, and we'll do our best to follow up with individuals separately as we have answers to those questions. And then also just reference that we've talked about a number of resources today on the Practice Green Health website, Healthcare Without Harm website. So those are all tools that you might want to look at for case studies, other examples of the work that's being done in this space. So just to close in our final minute, just a few other announcements. Okay, and the slide's loading, one moment. So just to note that I personally included links to a couple articles, so when you have access to the slides afterwards, you might want to check these out as they relate to supply chain and equity. Okay, and then just quickly, please join us for our Plant Forward Culinary Contest. We've streamlined it this year for a much easier entry. Submit your entry anytime between October 1st and November 30th. And then please join us for our next session, Collaborating to Build on Resilient Healthcare. If you enjoyed today's session, I think you'll find this one really informative as well. So I want to give a special thanks to our experts today, Curtis Lancaster and Shane Hughes, for their tremendous presentations. And I want to thank you for all of your support during this challenging time with healthcare. We're thankful to have so many collaborators and champions. So as we mentioned previously, we'll provide a recording as well as the slides to session registrants. And thank you so much for attending, and best wishes for a productive week. Thank you so much.